everyone. This is Dr. Brenden Cochran with Interactive Health Clinic. Hope you're having a fantastic day and had a fantastic weekend. What are we going to bring you with proactive health tips specifically today regarding the current COVID-19 coronavirus? So what we're going to talk about today is something I've been talking about for a while, this theory that children did not spread this bug. Well, one of the things we talked about in the past video, we said children don't seem to be getting hit as hard by this. And we now have an idea that it probably has to do with T-cell specific immunity. And pertaining to maybe that they have more thymus activity regarding that than, say, another one. An adult person who, as we talked about in the past, the thymus starts to decrease in size and function as you get older. So you're having less of that T-cell engagement. We also talked about the immune system's capability of recognizing other coronaviruses and considering that providing some T-cell immunity, which could be beneficial in this specific situation for the severity of what's going on. Now, some other interesting facts that we're seeing. The coronavirus or COVID death rate among the world right now is much, much lower than the US. We're doing a horrible job right now in both containing this, and part of it also has to do with mortality rates are much higher. Mortality rates, again, I'm going to talk about, I believe, are much higher because we have a very crappy terrain. People that are obese, people that love sugary drinks, and the way we manage it is still, in my opinion, very, very poor. So what do we go from here? Well, we want to get kids back at school. The issue that we're seeing is not is it going to affect the kids as much, but will it affect the older adults that might be more compromised? So then that means some of the teachers that would be in there, we have to be more careful with who is able to go back in person or who is not able to go back in person. The other thing we have to know is what is the health of the parents when that child is going back to school, because that child now we know not just the age of 10 or 12, but even the age of 5 can actively spread that to somebody else. The other thing we're finding out is our testing, again, is not 100%. So we have a rate of up to 30% false negatives, which is especially seen more problematic with those quick turnarounds where you get an answer within a matter of hours, right? More false positives and false negatives that are determined with that specific test. The reason I bring this up and the learning experience that we're seeing is if you were paying attention to the camp that was run down in Georgia, they had every single person in that camp screened and tested before they came to that camp. And then they had the staff members, the adult staff members, also wear masks. The children are not asked to wear masks. And I get it. It's a very, very difficult thing to ask a child to wear a mask for a long period of time. It's difficult enough to get adults to wear a freaking mask, right? So what this showed us, though, is in this experiment with about 597 people total, they had close to over 380 is, I believe, what was in this trial, if you read through that. 380 of them. So pretty much 2/3 of the whole camp ended up getting the virus, which means somebody brought it in when they tested false negative. It's the most likely scenario. The other scenario is somebody tested and then got exposed after the test. It just gives you an example of how slippery and slimy this thing is. And going back to school is going to be challenging. I don't have the right answers currently, but I do believe, again, it goes back to strong terrain, right? Strong terrain means that if we do have children back and we do have teachers back, the likelihood of them getting walloped by this thing is much, much less than a person with terrain. The other thing we may have to consider is changing our strategy of how to teach. And this is a prime time, I think, for teachers who have been undervalued just like, in my opinion, doctors, teachers, and police officers have been extremely undervalued in our society these days. It's a great way for teachers to suddenly say, okay, well, I'm going to go ahead and teach a pod of kids that, say, a couple parents that know each other. We're going to do a homeschooling or small activity, and I will be teaching those children. And this is the current rate that I'm charging per week. Great way for those teachers to suddenly gain some power and also work their way up. You know, I'm hoping this happens also in the police, and I'm hoping it happens also with our physicians too. We start to gain a little more power back, and people actually appreciate us more than the NFL football team or the NBL or the sports teams. It's really, really critical that we prioritize those people that keep you healthy, safe, and moving forward, more so than just, that's at least my bias here. So that is something that we need to be concerned about. Now, we also know micronutrient status is really, really critical. Here's another article I'm going to share with you at the end that actually looked at micronutrient status of people that had COVID-19 and critical considerations. The individuals, again, that had low vitamin D had a higher risk for complications, very high risk for complications. Another one we haven't talked about yet that is illustrated in this paper that was published in the BMC is that people that had lower intakes of vitamin C were also at increased risks for more adverse effects or getting walloped by this thing. What we're noticing, and if we continue to look at this, we're going to see if you're micronutrient deficient in things like vitamin C, zinc, your antioxidants, your vitamin D levels. As we've been talking about, with any chronic condition or any respiratory infection that's normally present, this is seriously important in how you handle it. And that's what we're going to see with this. And this is a serious problem because most of our foods are so micronutrient deficient because we either eat a very bland diet or our fruits and vegetables are grown in an environment where crops are very nutrient deficient in soil the way they're grown. And that's all problematic. And I believe that's a huge shining factor of why we are having such a hard time in this specific country. Finally, another proactive health tip that I found it was very interesting. We did talk a little bit about chlorella, which is a type of algae, but this one actually showed a cell study looking at seaweed extract. And they said seaweed extract outperformed remdesivir in blocking COVID-19 virus. It's published in the Science Daily. It was published just recently in July. Well, here's my comment to that. Most things are going to outperform remdesivir, unfortunately. If you look at the studies with remdesivir, they're not really good. The reason we're using remdesivir is because it costs $3,200 per patient per time that we're using it in the hospital. And you show me a problem, I will show you a solution with lots of money attached to it. So, a lot of things do work better than remdesivir. This study shows just seaweed extract alone can work better than remdesivir. So that's another thing that we need to consider. And the study also addresses the fact of my previous video talking about heparin, which is a common anticoagulant being used as a possible viral trap, meaning it is a decoy for the virus. So heparin is gaining more and more traction as a very helpful tool in using this. I'm hoping that you're watching these videos and you're seeing, man, we have a lot of tools. It's typically what we do in functional integrative regenerative medicine versus your conventional medicines. The tools are very limited in conventional medicine. Also, what we find in conventional medicine, unfortunately, most of the research has a very strong bias of what is going to be financially profitable. Now, natural medicine, we see the same thing though. People can do that where they don't show you the studies, they don't show you the research, and they're also making things up. But both sides can be equally just as bad and toting BS information. And really what we need to do is cut right down to the science, look at all the tools, and keep putting them to the test. All right, guys, have a fantastic day. Share this, like it. A lot of people do like these videos. Hoping you do as well. If you have any topics you want me to talk about, please do post or send a message. Happy to talk about them. Have a great day.